Hi everyone, welcome to PharmaGrid. So, in this video, we are going to continue with the patient profile based clinical type of questions. Starting with question number 16, a 34-year-old female insists on drinking a cup of grapefruit juice every morning for body cleansing. Grapefruit juice is known to interfere with the cytochrome P450 system, disrupting levels of certain drugs. The cytochrome P450 system includes dozens of enzymes, which is the most abundant cytochrome P450 enzyme in human livers. The options are CYP1A2, CYP2A6, CYP2D6, CYP2E1, CYP3A4. So in the question we need to find out the most abundant cytochrome P450 enzyme system in humans. Here the correct answer is option E, that is CYP3A4. CYP3A4 accounts for roughly 30% of human liver CYP enzymes. CYP1A2 makes up about 15%, CYP2A6 about 4%, CYP2D6 about 5%, and CYP2E1 about 10%. Many drugs are metabolized by this enzyme including cyclosporine, protease inhibitors, and benzodiazepines. CYP3A4 activity is also modulated by many substances that it does not metabolize, including grapefruit juice in the sense inhibition and St. John's wort, which is a herbal medicine in the sense of induction. Next question. A 19-year-old female has a history of absence issues. She currently takes ethosuximide to control her symptoms. The process of eliminating this drug involves multiple steps of metabolism followed by excretion. Many organs take part in both metabolism as well as excretion of drugs. Which of the following describes a step of metabolism? The options are acetaminophen glucuronidation by enterocytes, digoxin actively transported from hepatocytes into bile, ethanol passing from the blood into the alveoli, pancuronium being filtered in the kidney. So here the correct answer is option A, that is acetaminophen glucuronidation by enterocytes, which is a step of metabolism. Many steps are involved in the elimination of most drugs from the body. Ethosuximide, for example, undergoes phase 1 metabolism, that is hydroxylation, followed by phase 2 metabolism, that is glucuronidation in the liver. The metabolites are then excreted in the urine. The purpose of metabolism is to make the substance or make the drug more water soluble so that it can be excreted. Steps in metabolism involve chemical changes to a molecule structure, whereas excretion is simply moving a drug molecule from inside the body to outside the body. There will be no change in chemical structure. Of the options listed, only glucuronidation is a type of metabolism. The other responses are all methods of excretion. Now let's see why other options are wrong. Option B. The passage of digoxin from hepatocytes into bile involves no chemical change to digoxin. This is an example of excretion. Option C. Ethanol diffusing from the blood into the alveoli involves no chemical change to ethanol. This is also an example for excretion. Option D is about pancuronium. Pancuronium filtration in the kidney involves no chemical change to pancuronium. This is also an example for excretion. So only the option A is a step for metabolism. Remaining all other options are excretion methods. Next question. An 18-year-old man is scheduled to have 4 wisdom teeth removed. The procedure is done under general anesthetic and there are no post-operative complications. He is discharged home with a prescription for codeine for pain control. 3 days later, he contacts his physician and complains of difficulty moving his bowels. This type of adverse drug reaction is most similar to which of the following? The options are a desquamating rash in a 36-year-old male receiving trimethoprim sulfamethoxazole, aplastic anemia in a 12-year-old girl taking chloramphenicol, dizziness in a 65-year-old man after taking nitroglycerin, rhabdomyolysis in a 43-year-old male taking lovastatin, urticaria develops in a 7-year-old female after receiving a dose of penicillin. So here the correct answer is option C, that is dizziness in a 65-year-old man after taking nitroglycerin. Adverse drug reactions are broadly categorized into two types, that is type A and type B. A stands for augmented, which is related to the pharmacological action of the drug, and B stands for bizarre type of reaction, which does not correlate with the pharmacological action of the drug. Type A describes reactions that are either an exaggeration of the drug's primary effect, for example, headache following nitroglycerin because of its vasodilatation effect, or because of another pharmacological effect of the drug, such as opioids causing constipation as well as pain relief. Type B describes reactions that are unusual or unexpected, including allergic reactions. Type A reactions are often foreseeable, in the sense it is often predictable and correlate well with drug dose, whereas type B is usually much more rare and unforeseeable or unpredictable. Then let's see why other options are wrong. A desquamating rash in a patient receiving a sulfa drug may be Stevens-Johnson syndrome, a rare but serious side effect. This is not caused by the expected side effects or expected effects of trimethoprim sulfamethoxazole. So it is a type B reaction or Bezier type of reaction. Then option B. Aplastic anemia is a rare but serious side effect of chloramphenicol administration. This is not caused by the expected effects of chloramphenicol, so it is also a type B type of adverse drug reaction. Then option D. Rhabdomyolysis is a rare side effect of all statins. It is not caused by the expected effects of statins, so it is a type B reaction. Then option E. Urticaria in a patient following administration of penicillin is likely caused by an allergic reaction to penicillin. This is not caused by the expected effects of penicillin, so it is a type B reaction. Question number 19. A 17-year-old pregnant female asks her doctor what she can do about her acne. The doctor prescribes a topical benzoyl peroxide preparation, but the patient is unsatisfied with the results. She has a close friend taking a vitamin A based acne control product, and her friend often tells her how well it works. She begins taking her friend's pills and is pleased with the reduction in her acne. During which prenatal period is her unborn child at greatest risk for developing a birth defect? So let's see the options. The options are before conception, because the drug described is known to cause mutations in the maternal germ cell line. Then days 1 to 17 after conception, days 18 to 55 after conception, days 56 to birth. Vitamin A is a natural substance and therefore poses no risk of ill effects. Here the correct answer is option C, that is days 18 to 55 after conception. Development can be divided into three periods based on reaction to teratogens. The first period, which includes implantation, starts at fertilization, that is day 1, and goes to about day 17. Insults during this period have an all or nothing effect. This is because at this stage cells are still totipotent. So either so many cells are lost that a spontaneous abortion results, or enough cells are spared that can replace destroyed cells completely, so no defect is seen in the newborn. The next stage is the embryonic period, that is days 18 to 55. Organogenesis takes place during this stage, so any insults to the rapidly dividing differentiated cells during this period easily led to malformations. This is a period of development in which an unborn child is at greatest risk for a birth defect. Then days 56 to parturition comprise a fetal period. Insults during this period generally cause only reduction in cell number in the growing organs, not structural defects to the organs themselves. Question number 20. A 24-year-old primigravid female's water breaks at 39 weeks gestation. 24 hours later, she is having regular contractions 3 minutes apart. Her labor lasts 8 hours. At the hospital, she gives birth to a baby boy who initially appeared healthy. Within the next 12 hours, the baby boy begins to have temperature fluctuations, difficulty breathing, and reduced movements. You suspect neonatal sepsis, so intravenous gentamicin plus ampicillin is started. Gentamicin and ampicillin are commonly used together because the combined effect is greater than the additive effects of both alone. This increased effectiveness is an example of what principle? The options are agonism, energy, symbiosis, synergy. Here the correct answer is option D, that is synergy. Synergy is a term used to describe a situation when the combined effect of two or more drugs simultaneously is greater than can be explained by arithmetically adding the individual effects. A fine example is a synergistic effect when penicillin such as ampicillin is combined with an aminoglycoside such as gentamicin. Now let's have a look into the other options as well. An agonist is a molecule that elicits a response from a receptor by binding to it. The term can refer to endogenous or exogenous compounds. Energy refers to a lack of the body's immune system to mount a normal response to an antigen. It does not describe cooperation between drugs. Then option C, symbiosis refers to a mutually beneficial relationship between organisms. It is not used to describe interaction between medications. So we have completed today's question discussion series. Thank you everyone for watching this video. Have a pleasant day.